All right, good evening, everybody. You're joining the Board of Health meeting. Today is February 16th, 2022, and the time is 7 p.m. So let's call this meeting to order tonight. We'll do a roll call for the board who's present. Candace Linehan.
Laurel Silva, present.
All right. We also have Health Director Choi, we have Cindy Longo, we have Sherry Dalton. Looks like we're joined by the press, Mr. Sardella, good evening. And Mr. Mayo is here with us also. So why don't I quickly go through the agenda for the evening, let us know where we're headed. We are going to have a quick introduction by Miss Melanie Deneen, and she's going to talk to us a little bit about the Public Health Excellence Grant. I don't see her on yet. Okay. And then we will have a discussion of tobacco regulations with Ms. Maureen Busby. We'll have a discussion about the indoor mask mandate in town, followed by public participation. Before we get into public participation, I will speak again a little bit just about just a little bit of guidance before we do it. So if Melanie is not here at this moment, why don't we, Maureen, are you able to start with some of what you had tonight?
Absolutely.
Thank you.
Good evening, everyone. Nice to see you again. One of these days we'll do it in person. But a month ago, I spoke to the board, and what I did then was just review the new state law, which you'll remember was pretty robust, pretty complex. It covered a lot of areas, and some of the areas it covered related to tobacco sales regulations. And the board does have a role in tobacco sales regulations, both local regulations and in state. So what we did then was try to highlight those areas that were different, where the state law is different from local regs. Then I went back to one of my colleagues, DJ Wilson, who's on with us tonight, and asked for a draft of new regulations that would incorporate the things that we felt needed to be changed to bring local regs into line with state law. So not really changing anything, bringing things up to date or into line. So some of the things that were changed were simply adding some definitions that we didn't have in the local regs so that it matches what we're doing under state law. One of the definitions that was added was a definition for what we call ADOR, adult-only retail tobacco stores, those stores that you can only enter if you're 21 years or older. A definition for child-resistant packaging, a definition for retailer when it's not an adult-only store, and a definition for tobacco product flavor enhancer, which is something that we haven't had in the past, but is included in the state law. And then we also updated some definitions that we had in state regs, but they needed to be updated to match, either to match state law or just to be more explicit, because some of our definitions were a little bit older and maybe a little bit out of date. So some of the definitions that were updated were cigar, characterizing flavor, e-cigarette, or what we call ENDS, electronic nicotine delivery systems, liquid nicotine container, tobacco product, and also sales to minors prohibited. We also updated on this draft regulation the cigar minimum price. When Wakefield adopted, when the board adopted the cigar minimum price locally, the minimum that was chosen at that time based on, national data or whatever, was a minimum of $2.50 for a single cigar and a minimum of $5 for any multi-pack, whether it's a 2-pack, 3-pack, 4-pack, 5-pack, minimum price of $5. Retail can always charge more, but those were the minimums. In that regulation that was developed at the time, there was an ability to look at that pricing and change that pricing based on PSI or whatever it was. So Boston has done that. And so what we did in this draft was we adopted the price that, the new minimum price that Boston came up with, because they did the research. We can do it if we want, or we can accept their research. And so if we decide to bring that up to, you know, to today's standards, the new minimum cigar price, cigar minimum price for a single would be $2.90, up from $2.50, and $5.80 for a multi-pack. That's up from $5. We also added sections about required signage. I remember telling you there was a lot of new required signage. There's a whole section in here. Nicotine content in any ENDS product, electronic nicotine delivery systems, because the new state law does have a nicotine content restriction that applies to family-friendly stores. Adult-only stores can sell the higher nicotine content products, but it is restricted in family-friendly stores. And we talked last time about, in the past, a first violation of any of our tobacco regs did not trigger a suspension, but under the new state law, even a first violation, if it's a sale to a minor, triggers a suspension. And that's the way the language is written in the state law. That suspension can be anywhere from 1 to 30 days, and it's for the board to decide. So what I talked about last month was possibly considering selecting a fixed number of days, rather than saying 1 to 30 days, and you have to decide every single time in every case. Pre-select a number of days. Some other communities have done this. And because a second violation is 7 days and a third violation is 30 days, we thought maybe something less than 7. So whether that's 1 day or 2 days or 3 days or whatever number, then the board wouldn't have to meet every time there was a sale to a minor, first sale to a minor, and make that decision over and over again. So that has been added. And a section, of course, on the prohibition of flavored tobacco sales. So no sales of flavored tobacco in Massachusetts. So we've added that to the local reg. Prior to this, Wakefield did have a restriction. Only adult-only stores could sell flavored products, but now under the new state law, no store can sell flavored products. And of course, the fining structure. Under our old regs or local regs, the fine structure was $100 for a first violation, $200 for a second violation, $300 for a third violation. Under the new law, it's $1,000 state law, $1,000 for a first violation, $2,000 for a second violation, and $5,000 for a third violation. And I think, I think that's the summary of the changes. So some change definitions, some new definitions, some new sections, and then some changes like in amounts, certainly for cigar minimum price and for the fine structure. Any questions, Laurel?
Yes, thank you again for your fine work. Maureen, I paginated these things so I could keep it straight. So for me, it's page 9. It looks like we did not pull our arduous permit cap into this copy. So in the 2018 reg, we were trying to get licenses down by attrition. So we were not going to hold a license,
right?
If a storefront became something else and did not want the thing. So in the old regulation, it's F, permit cap.
So
I think you and TJ did refer to it. And
yeah, let me and DJ is on there if he finds it quicker than I do.
So where it should be, so number 11, maximum number of tobacco product sales permits. And so it looks like that's standard language, except that we had an arduous process because the density of tobacco sales retail shops in Wakefield was higher than our general area.
Right.
So we were trying to
Yep.
pull it down.
So,
I don't know if we would use the same language, but in the standing reg that we have, which I pulled up on our website and was last implemented November 1st, 2018. Though it's interesting, the language for the permit cap was the year before in 2017. It took us a year to,
yeah,
we spent a lot of time on this about 4 years ago, right? So the way we wrote it was, at any given time, there should be no more than the number of tobacco product sales permits at the time of the public hearing, November 13th, 2017. So that we have to change this anyways.
right,
Each
exactly. So
Yeah.
I
each
did
permit-
have Cindy look up and find out how many tobacco permits there were active on that night. And that's where the 28 came from. So we made that change.
But I thought it got down to 25.
So
What do we have now?
so we can have no more than 25. So that's just in terms of absolute number, but we still have the language that's, I thought I just looked at it. So we still have the language that applicants who purchase or acquire an existing business at the time of sale may acquire. And so essentially what we've done is we've said, if a business closes by sale or for any other reason, then someone has up to 60 days to pick up the permit for that address. If they don't, then that becomes permanently unavailable.
Oh, it is there. I'm sorry. I
Yeah. No, I had to read it twice, Laurel.
I thought I saw a waiting. So above, so you just sort of quoted the stuff from page 10, section B.
Yep.
And it's funny because new applicants, oh, that's it. New applicants for permits who are applying at a time when the maximum number of permits has been issued will be placed on a waiting list. And I sort of feel like we haven't made room for new applicants.
So.
Or we
okay,
could
I guess-
certainly.
Yeah, DJ, can you help us out on this? I guess the waiting list.
Elaine is remembering something as well. She was in the room.
Okay.
Yeah, I think that when we were talking about the reduction, right? And you were talking about that, Laurel, new applicants still are allowed to apply. I think we thought in terms of if, they sold the corner store was sold and it was sold again as a convenience store, okay?
Yeah.
They would be considered new applicants because it would be under a different name and a different owner, but we would still keep that one permit there. That would be, I think, the
Okay.
true concern, a
All
new
right.
applicant.
Right,
Yeah,
and
so-
It's written
and
so
it's-
differently. Yeah.
yeah, and
I
if
get it.
somebody,
Confusing.
if somebody didn't renew their permit, then you can go to that waiting list and say somebody else can pick up that permit for that location. So the person with
Right,
the
for
permit.
that, okay.
can't-
So
Yeah.
this language does cover this?
Yeah,
Okay,
It's
so I'm sorry.
confusing.
So, yeah,
No,
so
it
pardon
is-
me. So on first pass, I was like, wait a minute, what
Yeah.
happened? And that, and because it's formatted differently than
yeah.
our other reg, but it is more user friendly. I like it.
Okay. And DJ, did you want to add to that?
No, I think that's covered.
Okay.
Yeah, that is a very standard paragraph to let a buyer capture the seller's permit. Otherwise, you put it their business at a real disadvantage and is trying to sell it. Yeah,
Okay.
so that's standard language that we use everywhere now.
Oh, good. Okay. I think it was new language at the time, and I just reread it and went, there had to be a better way to write it. So I'm better seeing,
Yeah,
new and improved 2022. Thank you.
we have like
Thanks,
5
Laura.
capping options. It's really gotten much more complex since the first pioneers did it.
We were pioneers.
Yeah.
Thank you.
Other questions? Good catch, Laura.
And
Oh, actually, no, it was you did it right. I messed up.
But it is different. It is changed and you spotted it.
Well, yeah.
And just to jump on Maureen's, what she said earlier. In that violation section, Q1A, we, oddly enough, the DPH regulation in their penalty section doesn't talk about this, but if you go to a previous section, it says, anybody that sells to a minor, even for a first time, gets a mandated suspension. And so we didn't catch it early on. And it's something that almost no cities or towns had ever had a suspension for the first violation. But it is mandated by state law. And it would be helpful to pick a duration also. So when Maureen's talking, doing retailer education, and she's talking to them, she can tell them this is a set time.
Yeah.
So yeah. It also keeps you out of hot water, by the way, not having.
So it
street-
occurs to me it should be always greater than 3 because of holiday weekends. And for some reason, I'm happy with 5. I don't know why, but I don't know if the board has any other. A little random needs to be.
You think it needs to be greater than 3, or could it be 3?
It can be up to 30 consecutive business days is the way the state law is written.
Thank you, DJ. Laura, that question was to you also.
Yeah.
I think 5 is probably a good number, Laurel, because if you remember, we've always been lenient on having a permit pulled on a holiday weekend or on a weekend. You know, we've always started from a business day of like Monday. And where, yeah, it's kind of hard to say on a first offense. My thing was with the first offense, if someone sold their business and they had already had one fine, okay, that goes to that particular owner. But if another owner that owns a convenience store buys that store from them, they already know. So when they come in, is maybe DJ case, I mean, they know about it. So that's their first offense on that one. And it's like, you know that this place already had one, and you should have been, extra careful, I think, in my opinion, and done more education. So I think that, I don't think 5 days is not bad. If you did 3, that's half of the 7.
And just to jump in and note that.
Yeah, what are you seeing? Because I actually am rethinking. I don't think I read it correctly the first time. So go ahead. Sorry, DJ.
Just we have standard language in the permit section, number 9, that says a permit will not be renewed if the permit, oh, that's not even the right one. We have something there, a new permit won't be issued until all the previous penalties are satisfied.
Okay.
No new permit will be issued unless and until all outstanding penalties incurred by the previous permit holder are satisfied in full.
Wow. How is
So
it
if the
going?
new owner gets the new owner, DJ, that first one is done. Once it's done from that first owner, as long as it's completed, then that new owner is wiping the slate clean on that permit, right?
And we're making it clear,
That's
so when they're negotiating the sale, that's part of this, that's just something that is in the sale. So, it's, they just, so what would happen practically for a suspension is you'd have someone come in and say, I'm buying Joe's store on September 1st. Can I get my permit up and running on September 1st? Joe had an outstanding second suspension of 7 days, so we cannot give you that permit till September 8th.
But you're right, Elaine, the new owner has a clean slate, no prior sales.
Yeah.
They start fresh.
Maureen, how is it? So this has been in place for the state.
Yes.
How much experience have you had so far in citing any violations?
So we had 2 appeals in another, local community. I think the appeals were heard in August at Malden District Court, and which is another change that we talked about last time.
Yeah.
And we haven't received an answer yet.
So do appeals go directly to court? They don't come to us?
So it can go to you initially. The retailer can appeal to the board, but the decision that the board will be making, was there in fact a sale or not? And was the proper protocol followed?
Okay.
So then once you decide that and you say, yep, clearly there was a sale. In fact, a lot of times the stores have paid the fine. They admit there was a sale, but they want to say for some reason they should get a reduced fine or whatever. So so you determine a sale took place or not. But if a sale took place, the proper protocol was followed, meaning, the kid wasn't, dressed up like a 30-year-old or whatever, we didn't do something to change the appearance, to talk the retailer into a sale. The youth are trained so that they can't have a
Coercion.
conversation with the clerk, like, this is for my mom, or I left my ID at home. Can you do it just this way? They can't do any of that. So no entrapment. So once you determine sale was made, protocol was followed, then the only recourse essentially the violation was upheld. So the only recourse the retailer has is to go to
Oh, we just lost you. We can't.
in the state court. They can appeal the amount of the fine.
Okay.
They can try to appeal whether or not they can also appeal whether or not a sale took place and if protocol was followed. But basically what they're trying to do is get the fine reduced.
Right. And that triggers court.
Yep.
We can't do that. Thank goodness.
But in terms of the higher fines, just FYI, we probably have well over $100,000 fines issued in the statewide. I would guess somewhere 20 to 40 $2,000 fines and a couple dozen $5,000 fines.
Is it working?
Yeah, I mean, it really is it's quite a jump up.
Right. Yeah.
This is the state law. This is not something that we thought would ever happen. And so, it really is making I think it will make a difference, because we had gotten to the point that $100 fine really was just the cost of one carton of Marlboros. So,
Wow. Okay.
You guys share, DJ and Maureen, what number of suspension, like how many days have you seen other towns do?
oh, previous to the state law, which mandated it for a number of policies, we had some that had up to 90 days for a third.
The initial one is like what I was asking.
But I would say this 5-7 for second and third is very standard.
Okay.
It's pretty standard, yeah.
So second is already written. So the only wiggle room we have as a board is to determine the first violation.
Yep, right. And that's for sales.
And they are
only.
already on the hook for $1,000.
Yep.
Second and thirds are running between 5 and 7 days.
No, the
7
second
and 30,
violation.
misspoke. 7 and 30 at the second and
7 and
third.
30. Okay, thank you. All right.
Yep, they're concrete. So that's B and
Yep.
C on page 13. You guys have to help me out and put numbers on things. So do you want a motion?
So I think we
Are we ready?
could do a couple things, right? We could maybe first take a motion on the number of days, and if we can agree on that, perhaps make a second motion to accept the changes to bring Wakefield up to where the state's at with these regulations. How does that sound? So maybe I'll take a motion on the number of days for the first offense.
Madam Chair, I'll make a motion for under section Q violation number 1A to read, hold on, I just want to do this. Permit shall be suspended for 5 consecutive business days.
I second the motion.
All in favor?
Gorville, aye.
Silver, aye.
Linehan, aye. Okay, so moved. So that'll be 5 days. And then I'd take another motion to accept the state regulations as Wakefield's regulations, with the stipulation that the first offense for sale to a minor be 5 days.
I'll do it again for you. So
Go, Laurel, go.
You're good at it.
I'll make a motion that the Board of Health adopts a regulation of Wakefield Board of Health restricting the sale of tobacco products as presented by Maureen Busby to take effect we don't have to, just someone, DJ, can you give me a little help on take effect day of a regulation? In the past, we had to wait because we had to do public notice.
You still do, it's 30 to 60 days. It's whatever Maureen, she's out in the field, so she may have a better sense of what makes sense.
All right.
And either is fine with me because the education to the retailers has already been done on the state law. So I'm enforcing the state law. So the only change to retailers that I already talked to really, I think, is the 5 days. So, and up to now, I've just said to them 1 to 30 days, and I'll be so glad with a fixed number of days because they look at me like I have two heads when I say 1 to 30 days and the board will decide. So it's very good news. So we can easily go back to them and just update that. I can do it verbally. I can write a letter to every retailer or whatever. So the date is, it doesn't matter to me in terms of what I do. So if you
Is
wanna
there
say
a
30 days.
Is anybody in the room going to give me legal advice on whether or not this has to have a waiting period? Because in the past, when we've done these regs, we've had to give it a month before we, or we just have.
The month was probably just so you had time to put the newspaper notice in and to get a notice out to retailers. But if Maureen's already been talking to them, it really is, 30 to 60 is kind of standard. We're mid-month if you wanted to say 45 and it starts April 1.
Okay, I'm going to repeat the whole thing. I didn't do my homework. I make a motion to adopt regulation of the Wakefield Board of Health restricting the sale of tobacco products as described by Maureen Busby to take place. The regulation shall take effect on 4/1/2022.
That's with the 5 days. We have to say that separately with that all has to be in there. We're okay with, we already
did do the 5 days, right?
So I will second your motion for putting it into effect on 4/1/2022.
All in favor?
Gorville, aye.
Silver, aye.
Monahan, aye. All right, so moved. Thank you very much, DJ and Maureen. Much appreciated.
You're very
Thank
welcome.
you all.
Have a good night.
Have a good
It's
night.
amazing how much we've done on this in the decade.
Yes.
It is. Thank you.
Where's the rest of my stuff?
All right, so is Melanie on?
So is it okay if we move Melanie to the next meeting? She had another meeting she had to attend, so she wasn't able to stay on. So we can move her introduction and shared service description to the next meeting
Okay,
if possible.
Cindy, will you please add her to next month? Thank you. Anthony, since you started, why don't you go ahead? I don't know if you want to talk about the mask mandate and your health director's report sort of in one at once, or if you'd like to separate them out.
Sure. Yeah. So I'll just start. I don't have a whole lot for the health director's report. The one major thing that we had happen since last time that we're going to talk about tonight is the successful booster clinic that we partnered with the state VaxBus on. This was a successful clinic. We had capacity to give out 100 shots. I believe we had 78 individuals. Cindy, correct me if I'm wrong. I believe it was 78. Is that correct?
It ended up being 73.
73. Okay, 73 individuals came through at the Hurd School for our clinic. We gave out Pfizer. The state VaxBus gave out Pfizer booster shots, and it was a overall very successful clinic. We hope to partner with the state VaxBus again soon. And we hope to bring them possibly to the schools next to make it as available as possible, especially since the booster is eligible for the 12 to 15 age group. So continuing along our path of working on several measures that will help protect us from COVID. I think vaccination is one of those. And Wakefield has always been kind of at the forefront in terms of vaccination rates. We've been doing really well. And so we want to continue to increase that with our booster rates. So again, I want to thank everybody who came for that effort. I think it was a successful push, and we'll hope to do some more soon. I'm going to move into the topic for tonight. We're gonna do a discussion about the mask mandate, and so this was the indoor mask mandate put into place in early January. Since that time, we have seen a change in the landscape for COVID. For some of the counting numbers, and these counting numbers are not perfect. It gives us somewhat of a picture of where we're at. And so we've seen a dramatic decrease in new cases per day. Our positivity rate has decreased since the beginning of January. We're currently at about 7.5% positivity rate here in Wakefield. And so I want to have some cautious optimism here and say that we are trending in the right direction. The state of Massachusetts, as well as the nation, for the most part, are moving in the right direction. But there are a few things I want to caution against, is believing that this is completely over. I think that something we have to keep in mind is that though the numbers may be decreasing, there is still a risk for those that are unvaccinated, those at higher risk of underlying conditions. I think we need to keep in mind that those folks are still at risk of serious complications, right? And so since day one, we've been talking about the safest ways for us to participate in group activities. That's still continuing to mask, that's continuing to vaccinate when possible. Obviously, always consider, always consult with your physician. If there is any chance of a medical exemption, please talk with your physician. They will be able to give you the best medical advice. But some of the important things we want to talk about are that the mask mandate was just, as we said, a tool within our toolbox, and it was a temporary measure to get us out of this surge. Omicron really caused a spike, and then with all the gathering over the holidays, we saw that this manifested in January and into early February. And so right now, what we're seeing is a decrease in general of hospitalizations as well as deaths in the state of Massachusetts. We are almost at the pre-January surge numbers at this point in terms of hospitalizations and deaths. But something that we want to keep in mind is that the ICU bed capacity for our local hospitals is not reflective of a time when we are completely out of the woods. These percentages right now, and currently one of our largest service providers, Melrose Wakefield, is at 80% ICU bed capacity. And I believe that there are 3 available beds there in terms of ICU beds. And so Mass General, Leahy Hospital, all of these places are seeing still high levels of ICU bed usage. And that's not only COVID patients, but that's any kind of emergent case. And so we want to keep in mind that while we are at a better spot, we still have to be cautious about overloading our healthcare system. And so at this time, we want to be thoughtful in our judgment. And so looking at the numbers, as we did before when we put in the mask mandate in the first place, I think it is reasonable for us to now reconsider where we are and if the mask mandate is still necessary for town businesses as well. We will be considering the municipal mask mandate tonight. This will include town buildings. This is excluding schools. The schools fall within the purview of the school committee. But so these numbers suggest that we are in a better spot. And at this time, I would recommend that we can rescind the mask mandate for indoor facilities in Wakefield.
Thank you. So I'm going to invite the public to participate now. And before we get into that, just a couple things I wanted to share. Again, like Anthony said, tonight, our discussion is focused on the municipal and the indoor mask mandate, not the school. I was hoping to take a motion from one of my fellow board members on perhaps the length of time that we would invite our public to participate tonight.
Madam Chair.
How many people do we
Yeah.
have that are going to participate, Sherry?
All right, if anyone who is interested in participating tonight could put their hand up, that might help guide us plan this. So anyone who would like to participate, please put a hand up.
None?
I'm seeing none.
Just to be clear, this is the time for public participation, so you're welcome to just listen. But if you do have something to share, this would be the time to put your hand up and we will make a plan for you to share.
So,
Okay.
Madam Chair, while people are considering this, I had been prepared to make a motion that people be allowed to speak for 2 minutes with a 30-second warning, just to guide them where they are, after some feedback that the people who are not used to public participation get, can get a little stymied. So with that said, I would just make the recommendation. I don't believe we need to vote on it, though we might, that we go for 2 minutes with a 30-minute warning.
And we do, I just want to make a note, we do have one person with a hand raised. Yeah.
I see her. And
Yep.
you know what, just to follow process, why don't we go ahead and I would encourage a second if there's a second.
I'll second that to
Okay,
go with
okay.
the 2 minutes and a 30-second warning.
Excellent. All right, let's just take a quick vote, please.
Gorville, aye.
Silver eye.
Linehan, aye. Okay, so we are going to have Sherry help us with our time. And if, let's see, I have Mia Oliver and I have Chuck. No, I don't see Mia anymore. Would you, Mia, if you'd like to participate? Yes, okay. Mia, would you like to start? Miss Oliver, excuse me.
Sure, and sorry, my name's Irene Oliver. My daughter somehow got her name into my Zoom and it won't let me change it, so my apologies.
Well, good evening, Miss Irene Oliver.
Thanks. I guess I have a question. When you talk about buildings, does this include the Civic Center? Are you rescinding
yes,
the mask
so-
mandate?
Sorry, yes, I want to
on-
clarify. It does include the Civic Center.
Okay, so on the weekends, there are WBA basketball games that are being had there. Does that mean that those children will be able to remove their masks?
So generally, Madam Chair, you can kind of intervene here. Generally, public comment isn't a back and forth, so I don't want to break process here. But I guess I can answer the question after public comment.
Okay, we'll hold that question. Miss Oliver, do you have any other questions? We'll get to that question after public comment.
I know that the school committee voted last night, and I know this isn't part of it, but I guess I'm wondering why the recommendation for schools was different than the recommendations for buildings, when schools are buildings. So that's all. Thank you.
Okay, thank you very much, Miss Oliver. I see Chuck has his hand up, their hand up.
Yes, Chuck Schmidheiser, Oak Street in Wakefield, and would just urge the board to accept the recommendation and rescind the mask mandate as recommended by earlier. Thank you.
Thank you very much, Chuck. Is there anyone else who is interested to participate this evening?
I am not seeing anybody.
Going once, going twice, going 3 times. Okay, let's close public participation. Thank you very much for those who participated. Anthony, do you want to talk to speak to Miss Oliver's question at this point?
Yes. So just to clarify, I think I don't know if this came through, but I'll go back to the beginning. So the Civic Center is included in the municipal mask mandate lift. And so the mask mandate is no longer applies to the Civic Center. I guess I'll answer the last question now. In terms of schools, the reason we had made a different recommendation to school committee to keep the masks in place, it's a different environment. And I tried to explain this during school committee, but what I'll review here is essentially that schools are a much higher density setting. And so what we're seeing is children and teachers spend a lot of time in those classrooms close together. It's a very social environment. They're there all day in classes and participating in activities. And so, and we also have a subsection of students ages 5 and under that are still ineligible to receive the vaccine at this time. And so one of the things that we're trying to take into consideration is we're trying to ease into this new reality of masks being optional. And so again, one of the things I wanted to caution against was to just kind of, release everybody from this and then, work and not work towards this with some education pieces, kind of socialize this idea with the students, with the teachers, and kind of get families, comfortable with this idea of, a parent responsibility, a family responsibility. I wanted to make sure and, work with the school committee closely to make sure that this is a safe environment for students to go into. And then the last question, I believe, was regarding the WBA, the basketball league that plays in the Civic Center. I believe the WBA is not a school-affiliated sports league, and so the rules, I believe, do not apply. They can enforce their own rules in terms of mask wearing for their participants, but they are not a school-related activity, so they do not fall within that. I would imagine WBA follows the same guidance as MIAA, the Massachusetts Athletic Association. They do not. Okay, Laurel, you can go ahead and correct me there. I think MIAA may apply to some, but not all. So.
Thank you, Anthony.
Oh, sorry. Well, before we continue, Laurel, did you want to correct me on the MIAA portion?
I don't believe. I think that's an assumption.
Okay.
I can't speak to it, but we've, it is a little bit of a segue. I just wanted to mention, there's been, first of all, I want to thank everybody for both the participation in last night's school committee meeting, and we have gotten numerous letters. Most of them have been very respectful. I do want to just review process in the world of public health. And so when this all started, local boards of health are the most nimble to make quick decisions. But once a body above us, state or federal, puts something in, we can't make anything more lenient than that. We can always be more conservative. So essentially 2 years ago, we were getting together saying, we got to do something. And we actually put our mask mandate in and worked really hard with town leaders and worked together in both municipalities that health department staff shares. And then, our work was kind of done for us because state government made a mandate. And so timing has gone now in the reverse direction. And this is new for us because this is kind of the nature of pandemic. So in public health, for instance, we just had a tobacco conversation. Local boards of health kind of did the experiment. And if the experiment was successful, then the state would adopt things and you would just keep going forward. But we're responding and we're trying to be nimble, but within the edicts of how we have to govern. So for instance, to have a meeting, unless it's a dire emergency, which is the town is on fire and we have to get people safe right now, we have to follow rules, which is we have to post a meeting. It has to be posted at least 48 hours before we have it. So I just wanted to kind of review the civics around some of this, but please know that all of the board members have been really listening and really taking things into account. I support rescinding the mandate. It seems from all of the so much of the feedback that we've gotten is that it's the mandate it's the word mandate that seems problematic, and it is absolutely problematic to enforce. So we are trying to do the best for the town with the big picture. So even though we do know that masking is a good mitigation tool, at this point, the community can't tolerate kind of this all or nothing approach. So I would recommend, and we will, be going forth and working with our communications people, and we will continue our biweekly COVID-19 sessions. And I imagine that the school will continue doing what they're doing. I think we really need to adopt the language of advisories and for people to kind of have their go bag. So yesterday, there was a great comment by a public health physician who said that, you know what, we're going to have to start getting used to this like it's a weather report. So it's raining, get out your wellies and your raincoat, and the COVID number is over a certain index, let's say 10%, grab your N95 for the next 2 weeks. I think people have to adopt that kind of personal responsibility around their healthcare. So I thank everybody for participating, and I wait for more comments.
And then just to follow up Elaine, before you go, I wanted to make sure I wrap up so I don't forget that question. But no, I appreciate all your comments. The WBA question, what I will do is I will follow up. Again, Laurel's correct. I don't want to make any assumptions here. So I will follow up with the WBA, see what their policies are. But our indoor mask mandate lift is for municipal buildings. That includes a civic center. So we do not regulate them, but we will be working with them closely.
I guess I'm next, huh? I'm coming from the public health sector. I believe in vaccines. I'm a big vaccine person. I saw that the mask did work. Masks have worked. We have to remember that we're coming from a pandemic, which was a public health emergency, and we're now going in an endemic, which has been described as going from a highly contagious virus that is manageable and allowing us to regain a sense of normalcy. So what we're doing is I've looked at the numbers, I've done contact tracing. We're going into doing this as a personal responsibility for people who, if they have symptoms, we have more people doing home tests. We don't have a handle on that. Between the vaccine rate that we have in Wakefield, which has been very, very high, and the amount of cases that we have had of the infection, we've kind of come to a little bit of a hybrid immunity, as it has been described. I do definitely feel that we can lift the mask mandate. I think that it is time. We have to remember that there are businesses, there are people who are still very, very vulnerable to infections, and that if they wish to wear a mask, it's their choice and they can. I visited 2 particular surrounding communities the past week. I attended a couple of public health meetings with via Zoom with public health nurses, and I purposely went out as, like, quote, just the every ordinary day citizen. I'm going to tell you, I was so confused as to whether I had to have a mask on. I didn't have to have a mask on. I had to look for signs. I had to look for this. I feel that we can do that, but I really and truly want to wait just 24 hours. I would really like to get the communication out there to the businesses and the residents that the mandates have been lifted, and that where they can go for information, where their sources are. Businesses can go to show their employees, okay, they did vote for this. This is where you can go. And as we head in to do this as a personal responsibility to those who test positive, they're with their home test, they need to be directed. People are worried about, how do I tell my friends and my neighbors? We have websites, we have directions. I just would err on the side, this is just me in a public thing. I would just want a little bit of education out there to help the normal people. And I think the municipal buildings have done a phenomenal job on, following all the mandates, and so have the businesses.
Thanks, Elaine. Thanks, Laura. So I can echo most of what Elaine and Laurel said. I do think we seem to be going in the right direction, and I think that it is time for masks to be a personal responsibility, a personal choice. I do also want to thank all the residents who sent emails. I read every email, and like Laurel said, they were civil, and they all they're part of why we do what we do. They're part of the process, and I appreciate when folks participate in the process. I always learn something from reading and listening to public comment, so thank you. And one other piece that I kind of wanted to share, a lot of what I read and heard was questions about why Wakefield didn't make a change when Melrose made a change. And I think it bears to mention that even though we both share Director Choi, we are two separate boards in two separate towns, a city and a town. And so we do make decisions that are best for our town of Wakefield, and Melrose is going to make decisions that are best for their town, and they might not always be the same. But in this case, I think that rescinding the mask mandate in municipal and other buildings in Wakefield does make sense. And I think, yeah, 24 hours is fair. Do you think we need to have it be longer than that, like a day or two? I guess it would depend on how soon our communications department could get information up, or how soon our town website could possibly be updated to reflect this.
Candace, do you mind if I jump in?
I'd love it if you jump in.
Yeah, so just to go off of that, I think you and Elaine make a good point about the ramp up. Similar to the instatement of the mask mandate, I think it's important for us to message, how to safely, make the masks optional, right? It's a ramp up process to it. I would say we have an amazing communications team. Jen McDonald, working with the town, she's phenomenal in that respect. She works very hard on this, and she works very closely with us in terms of messaging. And so I would be very happy to work with her and get this messaging out as soon as possible, as widely as possible, with the resources that you had mentioned about how to safely go about life with the mask being optional and being mindful of others. So we would be more than happy to do that. I think that we can do it within a 24-hour time frame, but if you consider it necessary, we can make that longer.
Can't believe Chris is out. I want to do it.
I like the
I'm cold too, Dal. Let's put the heat on a little.
the idea that we use the language of optional. I like that language. I do think that like the point was made that there's still a place for masks, and it's important that we're all paying attention, and that things are still changing. They're moving in the right direction, but they're still changing. I do see Jen, you have your hand up, please.
Hi, how are you? I just wanted to let you know I'm here, and I can commit to working on this. I already started, so that's plenty of time for me.
Okay, 24 hours is doable.
Absolutely. Yeah.
Thank you very much. Okay, great. Any other discussion about this? If there's no more discussion, I could take a motion to rescind the mask mandate for indoor buildings.
Can I just want to add that silly lower hand button. Observing comments and human behavior as I have in town, I am expecting a collective unmasking tonight. I endorse the mandate being lifted on Friday morning. In reality, I don't believe we'll be in a position to do any enforcing. I would beg the public's patience so that we can do some positive public health messaging. But please refrain from finger pointing one way or the other. Like there's a new word that I learned called social deconditioning, and we need to get some reconditioning going in. And part of that is just being easy with each other. As an example, I I noticed that the mandate signs were down at Shaw's because there was an assumption amongst the public that we were either connected with Saugus's rescinding or Melrose's rescinding. And I nicely, said, yeah, we're not there yet. Give us a moment. He put the signs back up and is ready to have, in fact, he had the recommended CDC poster ready to go. And that's a pretty good poster. So I'm happy to make a motion that we rescind the mask mandate. We have been, just so you know, our original municipal building mask mandate was done with town council. Town council supported giving us, I don't know if the word is proxy, but supported, whatever we would be doing tonight. So our motion can include both municipal and all public areas. And again, as Elaine said, any business is welcome to say masks are required in their own shop. That's their own shop and it's the risk that they're taking. So we're still going to have to be pretty flexible. So the motion on the table that I am recommending is that as of Friday morning at 8 a.m., the mask mandate will be rescinded.
At midnight on
Oh, you're right.
at
Sure.
12:01 on
Sure.
February. Got to get that 12:01 in there.
Okay.
That AM for those night workers. Come on.
Okay. Okay. What Elaine said.
We just say it again. Just
Yep, I make a motion to rescind the mandatory mask mandate as of February 18th at 12:01 a.m.
I will second that motion.
all in favor.
Corville, aye.
Silver eye.
Linehan, aye. So moved. Great work. All right, guys. Any other business tonight? I believe we did a great job moving through the agenda. Thank you to everybody. And we'll talk to Melanie next month. Anything else, Anthony? Anything else?
If we do our, we got to do the approval of the minutes.
Yes.
Yeah, okay.
On that.
Make a motion, Elaine.
I'm like, wait a minute, did I had everything. Do you see how I spent 3 days of writing out everything I could think of, I'll make a motion to accept the minutes of the February meeting of the January 19th meeting.
Second.
All in favor.
Corville, aye.
Silver eye.
Linehan, aye. So moved. Thank you for reminding us, Elaine. Appreciate that. There was just one set of minutes that were still unapproved, I believe, right? Everything else is approved?
Mhm.
Okay. Do we talk about next month's meeting?
Sure, yeah, so next month's meeting, we're hopeful to include Melanie. She'll come back and talk about the Public Health Excellence Grant, the direction that we're moving in as a region, some of the important work that will be done moving into the spring here. I believe we'll have Maureen back to talk more tobacco. This is the year of community wellness, as we hope. Hopefully we're coming out of COVID at some point here, and we're going to move back to tackling some of these bigger public health issues. So we're hoping to really focus in on tobacco here. So we'll have Maureen back to discuss some other policies, and anything else that comes up, I will put forth on the agenda.
Any other vaccine initiatives that are happening?
Yeah, so we're currently working with the state Vax Bus to potentially provide a vaccination opportunity at the schools. It's pretty limited in terms of ordering vaccines right now, as well as the availability of the Vax Bus, so it may not happen until after the break. But we are still working closely with them to see what times are best. We're hopeful that there might be possibly an after-school clinic, or possibly even a weekend clinic, but we'll wait and see what availability they have.
Okay. I would guess caregivers have to be present, right? For kids under 16, maybe?
I believe with the electronic consent, and Laurel or Elaine,
Okay.
Please correct me if I'm wrong, but I believe they can consent through color. Color is the registration system. They can consent to have their child there. They also have on-site registration as well for anybody who needs that as well. They can have translation services through the Max Bus as well. So
Great.
Anthony, we got to do some budget work.
yes, this is budget season. It's a busy time. So that will be
prepared. Yeah.
That will be coming up. I think that there'll be some communication soon about this. Obviously, kind of a funky year. We're a little bit behind, but definitely going to work on that, and we'll be. I'll be in touch with the board.
Have we been scheduled for either presentation to town council or FinCom yet?
I believe the presentation to town council is February 28th. Almost September. February 28th. But we will be. I will be sharing that budget with the board before then.
Okay. We won't be discussing it. Just be looking. Okay. The new year, new way of doing things.
Back to normalcy. A while. It's going to take a while. It really is. And Jen, I do have a couple of have a website. I will send you the link. It's probably to put on the town paper. The town website. We had our Maven training yesterday, and they came out with some really good suggestions, because we're finding, and in contact tracing, a lot of people now, this is their responsibility to tell their friends, their neighbors, and their family that they're positive. And a lot of people are very, very nervous on how to go about it. So there are a couple of websites that will tell you how to say it, when to say it, and how to get on, and to do it so that they don't know it was you. And I'll send it to you. A couple of people have used it in public health, and they said it worked out very, very well. So, because it's very difficult, I think, for people to call, hey, listen, you were all over for the Super Bowl, and guess what? So, it's a little hard, and people just don't know quite how to convey that message to their friends and family.
Thanks. I look forward to getting that.
Thank you again, Jen, for being able to pivot and get this information out to the residents so quick.
Of course, yeah. Anthony, if you could just keep your eyes out for a draft from me.
Yes, absolutely. I'll be in touch soon.
Thanks.
All right. Thank you, Jen.
Anything else? Any other comments? Or if not, I could take a motion to adjourn.
I'll make a motion to adjourn.
Excellent. Is there a second?
I second.
All in favor?
Aye, Silva.
Linehan, aye. All right. Good night, everybody. And thank you, Sherry. I appreciate you being here and participating with the timing. Thank you.
Right.
Of course, very welcome. Good night, everybody.